Good, happy Tuesday evening, January 25th, 2022. I'm Riley King. Welcome to this evening news update right here on the Riley King Radio Network. Let's get started right now. First up, CDC Director urges New Hampshire residents to get COVID-19 booster shots. Let's take a listen to that video from WMUR News 9.
What you doing, babe?
Just looking at some old photos. I wonder what he looks like nowadays.
While New Hampshire is still in its Omicron surge, CDC Director Dr. Rochelle Walensky says when it goes, this wave of infection could recede quickly.
So what we've seen in other countries is that numbers have dropped just as precipitously as they have risen. So that is good news. What I can tell you, though, that's really important as we look to see those numbers drop is the people who are getting severe disease right now, the people who are in the hospital, are largely those who are unvaccinated and specifically unboosted.
We asked Dr. Walensky about public confusion over changes in CDC pandemic guidelines. She says part of the issue is the, quote, rapidly moving science.
We have to be able to pivot according to how that science evolves and that science emerges. And in that rapid science, we have to communicate why our decisions are made and how they are based on evolving science.
As far as long-term outlook, Dr. Walensky says talk of getting past the pandemic can begin once COVID releases its grip on hospitals.
First of all, I sympathize and I empathize. I think we all want to be done. This has been going on for a really long time. And I know that there's a motivation to say, when can we call this behind us? In my mind, the barometer here is looking at our hospitals. Our hospitals have to work. They have to be able to admit and care for patients with routine medical problems, with accidents, without delay. And so in my mind, I look to the hospitals all the time to say, how are they doing? Are they backed up? Do they have the healthcare workforce that they need in order to take care of everything that comes into them every single day? And when they have a break, when they are in reprieve, then I think we will be able to say we are at least getting to a phase where we can talk about having this behind us.
And Dr. Walensky says the CDC is also working to increase the supply of COVID-19 therapeutic drugs, but she says one of the difficulties in building up a stockpile like that is not knowing exactly which therapeutic drugs will be effective or ineffective against the next variant. Reporting live in Concord tonight, Adam Sexton, WMUR News.
Okay, and there you go on that video and that report. 25 more New Hampshire COVID-19 deaths announced as active cases decline. Let's take a listen to that video from WMUR News 9.
And to the pandemic now, New Hampshire is once again seeing a drop in active COVID-19 cases. They're back below 14,000 for the first time in 3 weeks. But DHHS is reporting 25 new deaths, including 5 just confirmed from more than 2 weeks ago. There are 860 new cases to report, with 136 from a backlog, and current hospitalizations are at 412.
Okay, and there you go on that video and that report. National Center for Missing and Exploited Children joins search for Harmony Montgomery. Let's take a listen to that video from WMUR News 9.
We're an organization built on hope. Until proven otherwise, we'll continue to look for this child.
For 38 years, the National Center for Missing and Exploited Children has assisted law enforcement across the country in finding children, and points to high-profile cases as reasons to stay positive about finding Harmony Montgomery.
There are too many cases out there, whether it be J.C. Dugard, Elizabeth Smart, Jamie Klaus. There are too many times that theory has been proven wrong to give up hope at this point.
Monday, the Attorney General's office announced a revised timeline of when Harmony was last seen and where, saying she vanished between November 28th and December 10th, 2019. Witnesses reported seeing the family living out of cars, a blue Audi sedan, and a Chrysler Sebring. But the case is challenging because so much time has passed.
So in Harmony's case, clearly 2 years has gone by. And from a law enforcement standpoint, missing child investigations, missing child cases are difficult whether it be 2 minutes, 2 hours, 2 days after a child's gone missing.
Experts caution about social media, saying it has a role, but can also be a catalyst for rumors and misinformation.
In Harmony's case, someone out there knows something. And the whole thing is to get her image in front of that person, let them know that this young lady's missing, and they need to step forward with the information that they know.
If you have any information that could help police find Harmony Montgomery, you can call or text anytime. The number 603-203-6060 or 1-800-THE-LOST. You can remain anonymous. Live in the newsroom, Amy Covino, WMUR News.
Okay, and there you go on that video and that report. Manchester woman accused of assaulting girl 3 after child taken to hospital with injuries. Let's take a listen to that video from WMUR News 9.
"31-year-old Jessica LaFerrier of Manchester is charged with second-degree assault and endangering the welfare of a child. Police alerted by a hospital treating a 3-year-old identified by initials SM with suspicious injuries.
Very alarming to see a child with so many injuries on multiple parts of the body.
According to police, her entire forehead was very swollen, the bridge of her nose swollen and freshly bruised. Bruises and abrasions on every part of her body, her head, face, neck, ear, both arms, right leg, buttocks, and entire back, all in various stages of healing. Court documents say LaFerrier lives with the girl's father and 5 other children. He told police he saw bruises on all of the kids and the excessive bruising on SM, but that Jessica always explained what caused them. She admitted to losing her cool and hitting the girl multiple times, saying she probably caused at least half of the bruises, admitting she didn't take SM to the hospital because she didn't want the staff to see her injuries and investigate her for abuse. Advocacy centers of the Granite State Children's Alliance do forensic interviews for police and DCYF, 2,000 children a year.
And the next time you see something that rises to a suspicion, call and make a report. You may be the report that sends that into some kind of an assessment that protects a child.
Now, reporting and resources are key to getting children and families the help they need, and you can find information for both on our website, WMUR.com. Reporting live, Jennifer Crompton, WMUR News Now.
Okay, and there you go on that video and that report. 2 hospitalized after fire in Concord apartment building. Let's take a listen to that video from WMUR News 9.
Imagine if everything had this power. Diehards choose Die Hard and Advance Auto Parts.
Well, Jen, the fire started right behind me here at the Morningstar Apartments. In one of those units there, the 2 people in that unit then were sent to Concord Hospital. Their injuries then requiring them to be air transported to another hospital for even more treatment. The fire department says the victims are a man and a woman, and that it looks like the fire started in the kitchen from cooking appliances. Firefighters got the initial call just before 2:30 this morning. When they got here, they had to give advanced life support. Other responders ensuring all flames were out. The damage is limited to the apartment where this all started. Battalion Chief Tom Nolt says there was a working local smoke detector in the building,
which is a good thing. We always want to make sure that the detectors are working, and as you had said, especially around this time of the year, a lot of people are using heating appliances in addition to what they have to keep warm.
People living in other units can now head into the building. The cause of the fire is still under investigation. Live in Concord, Grace Feinerman, WMUR News.
Okay, and there you go on that video and that report. And that does it for your evening news update right here on the Riley King Radio Network. Thank you for tuning in and listening. Have a great evening. Good night and goodbye.